Hi friends, I just wanted to share Nigel's experience recently. This series is called Little Pugs in the Big City. So if you do have dogs and you're living in the big city, I hope to share our experience so that you can care for them better, especially in the winter season. Now with Nigel, he is a pug, he's 7 years old. And with pugs, as you've noticed, they have shorter muzzles or shorter noses or airways, thus making them high risk for chest infections, chest conditions, and breathing issues down the line. He does have a history of aspiration pneumonia a few years ago, and he recovered from that. And now, during the winter, when February started, Nigel was having difficulty in breathing, much worse than this. His breathing rate was fast, and upon examination, his oxygen levels were very low. So he needed to be admitted and started on round the clock oxygen supplementation. As you know, or maybe you don't know, with regard to supplemental oxygenation, they can only go up to 40%, FiO2 40%. Fortunately, Nigel was only he only needed around 30%, and then they would train them, to be out of oxygen supplementation and see how they cope. So we were very lucky. Nigel was very lucky that he did recover. He needed less and less oxygen. For room air, FiO2 oxygen is around, I think, 24 or 26%. With his saturations, Nigel was hovering around 94%, 93, like low 90s to mid 90s. I'd like to think it's the same for human beings too, that Nigel needs at least mid 90s or above higher 90s% with oxygenation. But Ethan and I, we agreed that we are okay if his O2s were slightly on the lower end of the 90s, as long as Nigel looks comfortable, he's able to eat and do the things he loves. For management in the hospital, what really made the difference, I believe, was nebulizers and chest tapping, or chest coupage, which we also do at the hospital for patients, with chest infections and those who need chest drainage. We also continued that here at home. We bought the nebulizer for human beings. I'll show you a clip. And so I would do nebulizer for 10 minutes to 15 minutes using normal saline. And then I do chest tapping for 3 minutes, twice a day. Now, even if Nigel has already recovered, I still plan to do it at least once a day because I think that we're not out of the clear yet. We did an X-ray at the hospital and it showed lung consolidation on the right side. And the consolidation means the lungs cannot expand to allow adequate oxygen exchange to the blood. So Nigel's oxygen needs are much higher. Hence, he would breathe more laboriously. Fortunately, Nigel has maintained normal respiration rates as long as it's below 35 per minute on rest. That's when you count their respirations. It's when they're resting and not when they're active or stimulated. And as long as they're relaxed and there's no bluish coloration in their tongue or gums, that's the key thing. Another thing that really helped in Nigel's recovery is we started him on farmer's food, which he really loved to eat, and that's how we fed him his tablet medications. We didn't crush the medications anymore. We just chopped them into smaller pieces and then mixed them with farmer's dog, and he ate them. Before, we would feed Nigel once a day, but now it's twice a day so that he could take his medications. Okay, I'm gonna let him go. What really made the difference was the farmer's dog, and we've also cut Nigel's walks shorter. Usually before, we would walk them towards the far end of the block by the avenue, and then turn back. We'd even cross the avenue and go for another block, but with Nigel's lung condition, no. It's going to be half the block this time. Maybe more frequently, but definitely half the block. And please be careful during the winter time because I think these dogs with shorter muzzles are more sensitive to the cold and chest complications can occur. So shorter walks, be careful during the winter, farmer's dog food, and then the nebulizer and coupage. That was Nigel's management. We did blood works. There was no infection seen, but Nigel was on 2 antibiotics for 2 weeks, just as a prophylaxis to prevent any infection, because we don't know for sure what's causing the consolidation in the lungs, and we did not have the capacity to check further what was the cause. Was it aspiration, pneumonia? Did he swallow something? Did he breathe in something? We don't know for sure, but we were told that we'd have to just rely on the body to absorb whatever has gotten into the lungs. At the same time, Nigel has been prescribed theophylline just to help with opening and relaxing of the airways, and this other medication that's sort of like a cough suppressant, but mostly used for the swelling so that Nigel's airways would open up, because Nigel does have a narrow airway, like as small as a straw. That's why like it requires him to have more effort to breathe. But that's what you would usually see with dogs that have shorter nozzles, and there is a syndrome for that that's called BOAS, brachiocephalic something. I wrote it down somewhere. But yep, that's our Nigel, and we are so happy to report that we did a recent checkup with a doctor, and we had his O2 saturation checked, and it was at 97% on room air. That's nearly perfect. And these past few weeks, Nigel has been sleeping like a baby, like so quiet, to the point where I almost thought that he was gone, because he was just so relaxed. So it's all good news, and I'm so glad that winter is ending. But yep, this is a reminder to take extra care of your dogs if you're living in the city. They say that there's these extra toxic chemicals that they throw in when they salt the streets for when it snows. I hope you guys find this video useful, and please, if you're new here, please like and subscribe, because I think I'll be producing more little pugs in the big city content, because I want to document their cuteness and share them to the world. Let me know what you think on the comments down below, and I'll see you next time. Bye!